Well, thank you for being here. You are in the partner meeting for Blue Team Alpha. You're in the right place, and we are so grateful that you took the time out of your busy day in February of 2024 to join us today. We will kick this off here. My name is Sonya Meline. I am the Vice President of Business Development here with Blue Team Alpha. The title of our partner meeting event is CMMC and HIPAA Decoded Compliance and Sales Strategies. Promise you we are not actually going to try to decode HIPAA and CMMC compliance. Well, Dan might try to decode it, but we'll try to keep it light and just go over some of the highlights that are pertinent to our channel community. For those of you who just got in the room, my name is Sonya Meline, and I am the Vice President of Business Development with Blue Team Alpha. Excited to be here today with you. And I am a self-professed HIPAA nerd and healthcare compliance nerd. So I love talking about this topic. I did have a chance once before to talk about it, but this time I had a little bit more fun topics, I think, today to talk about. So we'll see what you think. And apparently, I have my fun fact. I used to be in a band that played at the House of Blues many years ago, but it was a good time. All right, and then today we also have our Chief Information Security Officer and Head of Information, Mr. Dan Wolfford. How are you today, Dan?
Doing good. How are you?
I'm good. And then Dan, your fun fact, we already talked about it last time that you have been practicing Wim Hof ice bath water meditation since 2019, but the update to your fun fact is you got a new ice bath.
Yeah, that's right. Two of my children are athletes and they wanted to get involved. They see me doing the ice bath. They wanted to get involved. So I saw one that was on sale, is the inflatable kind, just big enough for one person. So I bought that, got it installed in the garage. And then it's fun for the whole family.
Very fun. Different kind of fun, but I like it. All right. Okay, so today we're going to talk about CMMC, healthcare, and then how to use these as a tool in the world of sales. So, we are Blue Team Alpha. We are here to secure and defend the digital world. We do that with integrity, duty, excellence, and compassion. Compassion is a really big one for us, especially because we are often the first responders for cybersecurity incidents. And so it's usually a really rough day for the customer. So that is definitely a huge core value to us, and one that I feel is very important to our team, as well as our other values. I will share a few of our services. We do incident response, incident management. We have vCISO, SOC as a service, email hardening, pen testing, data recovery, endpoint defense, risk assessments, compliance, training, phishing. Those are some of our services. Let's hand it off to you, Dan, and jump into CMMC compliance and hear an update from you on that.
Yeah, it is my pleasure to demystify CMMC. What is it? How did we get here? It's actually really simple when you dig into the roots, understand how did we get here today. So this timeline starts in 2023, but I'll just go back a little bit. If you remember the OPM data breach, of course, we can't start at the beginning of time, but if you start in 2015 with the OPM breach, it's like the biggest government security breach of all time, in my opinion. All of our security, our records and our background and our interview for everyone who has held a clearance up to that point was stolen by most likely another nation state. And that triggered a chain of events that got us to where we are now. And I'm sure there are a lot of things that led up to that. But if we start at 2015, that's when the DoD started to add cybersecurity to DFARS. So DFARS is the Defense Federal Acquisition Regulation Supplement. It's how the government hires contractors for services and products. So they started adding cybersecurity as a requirement in 2015, 2016. So after that, of course, you have a presidential election, and then you have some new initiatives. Every time, we have a new president, especially if they change from Republican and Democrat and back and forth, you have new executive orders and you have new rules that get proposed. So in 2016, that's when we started to see more executive orders related about cyber warfare. and there was a system that was called SPRS, SPURS, and NIST came out with this the 800-171. Now, NIST 800-171 was supposed to be how contractors could be compliant with this DFARS clause that says you have to protect government data. And in order for you to get a contract with the government, you have to protect our data. In order to do that, you need to follow these NIST rules. You know, NIST, that's what they do. They create the standard, the national standard for technology. So that NIST 800-171 was the list of 110 controls, security controls that companies would have to follow in order to do DoD contracting. That was the idea. That's really what happened before that led us to CMMC. So CMMC was a good idea by the CISO at the time, Ms. Katie Arrington. She said, you know, we recognize the fact that contractors are supposed to be doing a self-assessment, right? Like we want to trust them. We want to trust that they're doing their own self-assessment following the NIST 800-171. But in reality, the self-assessment is weak because NIST is not very detailed. It's very vague, and it's open to interpretation. It's broad. Different companies are doing it in different ways, and even though that was the standard, there was no way to really know if contractors were truly implementing those 110 controls. So they came up with the idea for CMMC, which is about not only following 800-171, but also at what maturity level. So you can be doing like a very basic CMMC, but be very immature. Like you've budgeted for it, you've talked about it, it's on the roadmap, but you haven't implemented it yet. So it's not mature versus someone who's been doing that control, like access control. They have a solid plan. They've been doing it for years, and they're doing it following the industry best practices. That would be more mature. So CMMC that's the idea behind CMMC, is how can we make sure, how can the government make sure that all of these DoD contractors are actually implementing 800-171. So now we come to this little timeline where you see in November of last year, there were some updates. And then in December, the final rule was proposed about what the new CMMC version 2 is going to look like. And it's still in a public comment period where all of us can go in and write comments about CMMC. Good, bad, ugly. We can complain. We can make recommendations. So far, the last time I just checked it today, the comment period ends in 4 days. So if you guys want to go and write a comment about CMMC, we still have 4 days. And so far, there are 165 comments that have been posted about CMMC. So once that's over, the DoD is going to, finalize their process. They're going to the rule will be finalized, and then it'll go into effect in a phased rollout over the next 3 years. And if you go back to the original DFARS, where this whole thing started, DFARS says that you have to be current within 3 years. So it's not like SOC 2 where you have to go and get certified every year. You just have to have this CMMC certification in less than 3 years. So it'll be, the wording is, they say tri-annually, but we just like to say every 3 years. That way people don't think you have to do it 3 times a year. And we're so now going back to DFARS, you can take a screenshot of this, and I do, I encourage all of you to read DFARS because that is really the root of where all of these rules and regulations come from. So the main one is 7012. If you go on YouTube or go to other webinars that talk about CMMC, they're all going to reference 7012. But what I don't see when I watch these videos, I don't see them talking about 70, 19, 20, and 21. Those are also related to CMMC, provides a little extra guidance. And also DFARS is coming out with a new clause sometime this year that is going to be related to CMMC. It hasn't posted yet, but as soon as it comes out, we'll talk about it in a future webinar.
We have a couple of questions, and for those of you who just joined us, you're in the Blue Team Alpha monthly partner webinar, and you're hearing from Mr. Dan Wolfford, our Chief Information Security Officer. Dan, the questions that we have from the audience are one from Ryan R. as in Romeo. Ryan says, if a contract has a DFARS 7012 clause, but the contractor doesn't receive or create CUI during execution, does the contract work need to be done in an 800-171 compliance setup?
Right. So the question about whether or not you have to be compliant with 800-171, it does depend on the contract and the government office that is putting out the contract, because they're the ones that's supposed to be doing the assessment. Based on the DFARS rule, the government does the assessment. They changed that for CMMC to allow a lower level assessment that can be done as a self-assessment. And that's where, company like Blue Team Alpha comes in to help customers do the self-assessment for that basic level of CMMC. So my answer to that would be to go actually research what office put out the contract, and then what are they going to be required? What are they requiring? Because they're the ones that have to actually do the assessment and then sign off saying that this contractor has been assessed either low, medium, or high. And then whether or not you have CUI, you're still going to have FCI, like the federal contract information still has to be protected. So even though that company may not need to be CMMC certified, I would still encourage the contractor to go talk to the office, the agency that put out the contract, and find out what do they require specifically for that 7012 clause. Because maybe it is NIST 800-171, just like CMMC. But CMMC is just certifying that you're following NIST. So if you're following NIST to satisfy the 7012, then you're most likely going to pass CMMC as well. It's just that's just how things are connected. It's all DFARS at the base level, and then NIST provides us the standard, and then CMMC certifies that you're doing those NIST standards in order to fulfill the DFARS clause.
Okay, and we've got more questions coming in. This one's from Chip B as in Bravo. Chip asks, has there been discussion on what the certification will look like and how the attestation will take place, how attestation will take place? And then there's a second part to that question, but we'll start with that.
Yeah, this is exactly the kind of questions that I would encourage you guys to post on the government comment. We're in that government comment period for another 4 days. I'm not the authority on this. I can give you my professional opinion, and which I'm happy to do. I'll answer all of these questions in my opinion, but it's not the authoritative answer. We have to comment on during this comment period to get clarification from DoD, the one that's making this, the official requirement, the one that's going to publish the new DFARS clause based on these comments. But to answer that question, how it's going to look, so from what I've read, they're still going to be allowing the self-assessment for the basic, the low level basic certification. When you look at all 110 controls, you have to have at least 95, and then you have to have a plan of action with milestones to be 110. From what I've read, the government is still expecting all contractors to be compliant with all 110 security controls. But when you do a self-assessment, they don't expect you to be 100% on all 110, just to have a plan of action to get 100% at some point in time. And the medium and high level assessments are supposed to be done by the government agency who put out the contract. That's the way it's written in DFARS. It's supposed to be done by the government, but they can't. I guess they don't have, the manpower or the ability to do 100,000 assessments. So what they've done is they've allowed third-party assessor organizations to be created. So CMMC has the accreditation body, the Cyber AB. They're responsible to help, decide who is able to be one of those third-party assessors. And Blue Team Alpha, we don't have plans to become the third-party assessor, but what we can do today is help companies do the basic self-assessment and like for CMMC readiness. We can go through all 110 controls and make sure that you will be 100% compliant when you go get a true audit by one of those third-party organizations or the government office itself.
Yeah. All right, next question from Adam G as in golf. Adam says, for the triennial assessment, are self-assessments still required in the off years? If so, can the same company perform both on your behalf?
Honestly, I don't know. I can research that and try to find the answer, but off the top of my head, I don't know. I have read the DFARS that says you have to have a current certification within the last 3 years.
Right.
In the off years, I don't know off the top of my head what happens in the off years. My personal recommendation, just from my perspective at Blue Team Alpha, we would love to see contractors still maintain their security posture through the entire time. So it's not a once every 3-year situation. It's more of a continuous. And in the next slide, I'll explain more about what we mean by continuous compliance. Now, here's something big that I would like everybody to be aware of. NIST 800-171 is very basic. If you see here 3.1.1, it's one sentence. Limit system access to authorized users. Processes acting on behalf of authorized users and devices. That's it. And if you go and you want to be compliant with 800-171 and you just read this one sentence, that's very broad, is vague. It doesn't tell you exactly how to do it. What I encourage everyone to do is read 800-171A. Next slide. You will see that 311 breaks out into A, B, C, D, E, F. And in order for you to be compliant and to get certified CMMC, every single one of these has to be yes. So if the auditor comes in and says, well, you're doing A, B, C, and D, but you're not doing E and F, they're most likely going to say you're not doing 311. And so that would be a miss. And then that you would have to have a plan of action with a milestone of how you're going to do those missing sub controls. Now, if there are 110 controls in 800-171, if you add all of these sub controls, there's over 300. So something to be aware of. So that's why I recommend reading 171 Alpha, because it's going to give you more detail about the control. Next. Next. So this is a very basic use case that we see every day with customers that are wanting to be ready for CMMC. It's not required, but we're responding to RFPs as well. We have a government team at Blue Team Alpha, and we are starting to see CMMC mentioned in the RFPs. So if you're going to go out and try to get a government contract, you're going to already see CMMC level 1, level 2 mentioned. You know, saying at some point in the future, it is going to be required. Within the next 3 years, it will be required. But for now, we're just seeing it mentioned. In this use case, a customer wants to be ready for level 2. CMMC version 2, level 2. So that's still using 800-171. Level 3 uses a different NIST 800-172. So level 2 is 800-171. They're going to improve their entire security program, and we've estimated the budget at 118,000 based on an assessment that says they're going to need a lot of work. They're probably less than 50%. Their security plan is less than 50% ready for CMMC. So if we add everything that we recommend in order to get to 100%, we estimated that budget to be at 118,000 for the year. Next. So the objectives here are very simple. It's to just achieve and maintain compliance with CMMC version 2, and it's all public. It's very easy to follow. We're going to identify and mitigate any threats. That's the whole point, right? I mean, that's why they even added cybersecurity to DFARS in the first place, because of the threats, because of major breaches like OPM. We want to enhance their ability to respond to those threats. You know, being able to recover quickly. That way, the threat actor is not dwelling in the environment for weeks and months. If there is an incident, we can respond quickly. and also do tabletop training so people get comfortable with the plan. Also implement proactive monitoring, dark web monitoring. If there's any kind of data leaks, that's always going to happen first. Before ransomware ever goes onto a victim machine, it always starts with a data theft. So we want to be monitoring for that activity. That way, we potentially can prevent a ransomware attack by seeing the precursor incident. And then develop a comprehensive plan for that continuous improvement, year-long, multi-year, 36-month continuous CMMC compliance. And all of the changes that happen within that 3-year period is being proactive and being ready. So that way, when the next 3-year period comes up for certification, you've already been mindful and vigilant the entire period. Next slide. So in this particular use case, this is the entire plan in 3 buckets. So the first 3 months, we can do the assessment and do the planning. After 3 months, so for the next 9 months, basically the first year is when we do the implementation. Everything that you find during the assessment, and then you figure out where the gaps are, you can prioritize the gaps, create the POAM, that plan of action with milestones, and then so for the next 9 months, you actually implement. And this is something unique, at least with Blue Team Alpha, is the fact that we do both. We do the assessment, we create the POAM, and then we have the team that actually can do implementation as well. And when we combine those two, that's where you get the comprehensive CMMC solution. After the first year, the next 2 years, that's the continuous improvement, continuous certification and compliance with NIST and other best practices. There is a lot of crosswalk between other frameworks like ISO and like CIS. There's a lot of overlap. So, if the company who wanted to be CMMC certified was also interested in getting certified in other things, it's possible to do that because the security controls are overlapping. And then the best case results, the customer achieves and maintains compliance with CMMC2. They win their contract. They're doing business with DoD. They're protecting the federal contract information and the controlled unclassified information. They have improved visibility into all the threats and their vulnerabilities. They're being proactive for risk mitigation. They have a good incident response plan. The whole executive team has good communication. They know what to do and who to call. Insurance is a part of it, so they know that they're covered. They have legal oversight. They're monitoring the dark web, so if something leaks, they know about it quickly, and they have a plan for just to maintain that security posture throughout the entire the contract with the government and beyond. So that's it. I hope this helped understand a little bit about how DFARS is related to CMMC and how the NIST guidelines are flexible, but really Blue Team Out, from our perspective, we want to lean more towards having good security, and compliance is just the beginning. We'll do CMMC, get certified. Now you're compliant. That's a good start. Now, what else? What else can we do to have really strong security, in order to protect ourselves and the government?
Yeah, we got some positive, happy emojis from Chip B, as in Bravo. Thank you, Chip, and to a couple others there. We did also get one more question coming in from Brooke J, as in Juliet. The question is, how do you balance the need for robust compliance with the reality of a limited budget?
Yes.
And resources for smaller businesses, for my customers? Are there any cost-effective strategies or tools that you could recommend?
Absolutely. This is something that I care about very much. It's something that I've been studying to try to understand the problem and how to fix this. This is, by the way, the most frequent comment that I've read for CMMC during this comment period is about how do we budget? How does a small, medium business afford to be compliant with CMMC? This is a high bar. So my answer to that, and probably will always be, it's definitely a trade-off between security and cost. And The easiest way to do it is look up quantitative analysis. Most cybersecurity that I've seen is focused on qualitative. Like they say a threat is low, medium, high, or it's a critical threat. It's rarely connected to the cost. But when you do quantitative analysis, which there are tools and companies focused on this type of analysis, that's when you connect the threat to the cost. So in a very simple example, if your company goes offline for 30 days, how much will that cost as a percentage of the total revenue of the company? You can use that number as a way to scale your security budget to say, all right, if we're going to lose $1 million by being offline, I can't spend $1 million to prevent that from happening because it cancels out. So my budget has to be something less than what we would potentially lose in that attack. And then this all becomes a statistics game like they do with insurance underwriting. You know, if there's a flood, how often is there a flood? You know, that type of math.
Yeah. All right, we are going to jump into some healthcare compliance. I'm going to take you on a quick little journey into healthcare compliance on how it stands today. So what's new? New right now is definitely what you're seeing coming out of New York. There are some other states that are looking into this, but New York's the first one really to propose really strict regulations for hospitals as it pertains to cybersecurity. And why are they doing that? Well, they've seen a 53% rise in data exfiltration, ransomware incidents, and and why is everyone targeting hospitals? Isn't that the lowest low life thing you could possibly do? It is, but the reason why is that data is very valuable. It encompasses demographics and financial information and medical information. And despite its huge value on the market, it is often overlooked from a cybersecurity standpoint. Healthcare organizations are focused on delivering patient care, not cybersecurity. Unfortunately, they have to focus on both. And so this is the truth. In New York, they're saying, hey, we're gonna strengthen HIPAA, and we are going to impose enhanced requirements for incident response planning and cybersecurity measures. So any customers in the New York area are definitely going to want to be aware of that. They're also really looking to, the governor really believes that implementing these critically important rulings will help these organizations further establish their programs and reduce the risks. And one of the big things that they're going to ask for too is just that every hospital needs to have a CISO on staff. Can you believe there's some that don't? They need to implement multi-factor authentication. They need to have enhanced written policies, procedures, guidelines, standards. All of this stuff needs to be in place. And then, of course, like I mentioned in this bullet point here, is that incident response plan. It needs to be figured out. So you'll see other states, I think, increase these regulations as HIPAA just doesn't quite, this is a ruling. HIPAA is an act that came out in 1996, long before, the types of hackers, the sophisticated hackers that we have today. So, and HIPAA, we'll talk a little bit about some changes to HIPAA, but there haven't been enough really to keep up with what's going on. So speaking of HIPAA, what's new? Really some stuff in the substance use privacy and reproductive health privacy. Those are a couple new rulings. But the one that's really standing out for me is this new proposed security rule. So that would talk about, so other than the confidentiality and the substance use and for people with substance use disorders, and then the PHI, which is your protected health information. Other than that, you've got part two, you've got proposed changes to the security rules. So that's, so 96, right? We had HIPAA, and then they came out with the privacy rule, and then the security rule in 2004, and then in 2013, back when I was a new I was a new compliance officer in 2009 in the healthcare space, but I remember 2013 when the omnibus rule finally finished, because it took 3 years or something to finally get it out there. which really enforced the privacy rule. That's all it did, is it really enhanced and enforced the privacy rule. Because before that, you know, you were held to these standards, but there was no one kind of putting your feet to the fire. So that it came out, but there hasn't been a lot of changes to the security rule. So it's exciting to see in 2024, finally, after years, we're going to start seeing some changes. There is, you know, this did come about due to this concept paper, which we'll talk about. But a lot of it is about establishing voluntary cybersecurity goals for the healthcare sector and providing resources and incentivizing organizations to have more robust cybersecurity practices that can be overseen. HHS is obviously a big part of this, but OCR is the one that the Office of Civil Rights is the one that actually does the enforcement. So they're going to expand, and they're going to expand the ability for HHS to help be a part of this whole thing. And I don't know exactly how they're doing it yet, but that is something that we're seeing. There is a comment period actually happening still right now. So then the last thing to mention is just it's already over. This ended last year, but with those, I think we know there was some leniency due to stopping the spread of COVID, that sort of thing, that was went all the way up until kind of middle and end of last year for telehealth, and so now enforcement is back in full effect. You're not getting away with it saying, oh, because of COVID, blah blah blah. So emerging threats, ransomware in healthcare. This is a huge issue, right? And this is some surveys that I compiled with our marketing team. Thank you to them for helping me with this. And these are showing a 75% of healthcare organizations experienced a successful, that's such a sad word, a successful data encryption by cyber criminals. It took 5 days from the attack initiation to detect. That is actually down. The organizations were able to disrupt the ransomware attack before data encryption. There was 24% of those, marking a decline in prevention rates. There were 90% of attacks that occurred after business hours. So our MSP partners out there, you know, you're losing customers after hours. That's why it's so important to have an incident response firm on retainer for each customer, so that, you know, it's coming in after hours, right? Nights, weekends, when you're on holidays, when your staff's taking the breaks, you know, that's why it's so important. Primary routes are cause of attack are compromised credentials, right? That was definitely number one. These healthcare organizations that were surveyed had about a week of time to recover from attack. About 47% of them took over a week. I think that's what it was supposed to say. And then we have the percentage of healthcare organizations paying ransomware payments. In 2023, it was at 42, and so far this year we're at 61%. So just a couple things to see in ransomware world. Okay, so CISA and healthcare. You know, this is a little bit new for them. The CISA, which is our Security and Infrastructure Security Agency, has released healthcare specific guidance based on comprehensive risk assessments. So they conducted this massive, I mean, it was like, I think 30 something organizations, and they did penetration testing. This all came out when they finalized their report, was in December of last year. And so they shared insights from what they found to help us, you know, people who are trying to protect these healthcare organizations with the guidance that they found. So this includes common vulnerabilities. And so we just want to emphasize the value of leveraging these recommendations, because these are real life, you know, penetration tests and vulnerability assessments that they did. So really, it's using phishing resistance multi-factor authentication for administrative access, verifying the implementation of appropriate hardening measures, and change, remove, or deactivate all default credentials. Why would you have default credentials that shouldn't exist, right? It's like, oh, and then implementing network segmentation controls. So these are things we can definitely help with, and I know our MSP partners are really jumping in on that stuff. The HHS cybersecurity strategy overview. So HHS Health and Human Services, of course, has outlined a comprehensive strategy for the healthcare sector, including voluntary performance goals aimed at preparing the industry for the forthcoming enforceable standards. So it's like start with your voluntary goals and then you'll be ready for when they are enforced. They're working to collaborate with industry stakeholders to enhance the cyber resiliency and protect patient information from these evolving threats. And so if you're interested in seeing any of this stuff, I have links that we can share that kind of goes into more details on this stuff. Let's jump into a case study. So, and there's a ton of these, right? But this is one that just jumped out at me. And then we'll actually go into a case study of one of our actual customers. This was just a very public breach. And I wanted to share this because there's 845,000 patients impacted by this breach from Sutter Health. This is they got a ransomware attack from the MoveIt file transfer, and that was through WellTalk. They are a vendor operating an online contact management platform. They notified them of the attack. The breach occurred in May. With an unknown actor exploiting the vulnerabilities to access the data and exfiltrate it. That was just the patient information. It didn't include socials. It did not include the financial data. But just scary stuff. And what I like to do is not, scare our customers, but what I do is I try to find a breach that was similar to their organization's size and scope. And then when I'm talking with them, I can bring up these types of breaches just to kind of help them and guide them into how attackers were able to get in to the other organizations' networks. So let me go into a case study of a customer of ours. The customer's name is not really this, but it is, the rest of it's all, real stuff. So the problem is they had a mounting compliance concerns. They were really trying to get a contract with a Fortune 50, they're trying to get a contract and they couldn't get it just because they had a lack of cybersecurity maturity. And so their lack of incident response, they had poor HIPAA documentation, they had not enough really staff within the cybersecurity department to manage a lot of their concerns. And they had a big fear, right, of suffering from ransomware. And they had a lack of training within their organization, and they had mounting concerns with HIPAA. So this is sort of what we were able to provide them. An easy plan that helps them meet the requirements, comprehensive cybersecurity program, an incident response retainer, and end user training. And this is kind of what that plan looked like for that organization on a monthly basis. You can see right in the middle of the month, we put a HIPAA risk assessment that meets their annual HIPAA risk assessment compliance. And that is really the only thing this whole customer started with was they wanted a HIPAA risk assessment. And then we built out this entire other plan to help them meet the needs of their organization. So it a lot of times really does start with compliance, right? Because that is mandated, right? It's a requirement. So if you can help build out the rest of their year-long plan around all of the stuff that the HIPAA risk assessment. So we didn't start with the risk assessment, right? We pushed that one out to June, but we started with the vuln scan, and then review of their cyber insurance, incident response planning, consulting, building out a plan. This included some other stuff down here, cybersecurity training, and this was monthly. So we did this stuff every single month for this. We're still working on this customer. So this is just a quick example of how compliance was used as a full and encompassing trigger for a lot of other services around cybersecurity. So speaking of that, let's just jump into using compliance and sales tools as a sales tool and a buying trigger, right? So compliance is, particularly HIPAA regulations, as well as CMMC, these remain key priorities for organizations. So it is important for us to be able to identify and understand those compliance needs. A lot of times the customer doesn't even understand how to meet those compliance requirements. And so demonstrating that, and I know we're running just out of time here, so let me quickly go through this. We're going to want to showcase how the MSP or the trusted advisor can position themselves and guide the clients through the compliance requirements by implementing effective security measures. So I think that this is just, building that trust, building that credibility, and then using compliance as a competitive advantage, because you can shed light in an area that they're going to be struggling with. I mean, you read some of these regulations, they're super tough to comply with. So, and we just want to, make sure you understand that we're here as a partner with you. We can provide resources and training opportunities. We can help you deepen your understanding of healthcare, as well as CMMC, as well as, FFIEC. We have a FTC safeguards. We have NIST, ISO. I mean, we have a litany of acronyms that we can, help you deep dive and not necessarily, you don't have to be the expert, right? That's where we want you to lean on us with your team. And we're excited to help with that. We want to be there to help you take proactive steps in educating your team within, training within your organization. We encourage you to, maybe do a monthly compliance training. If you are in a space where you're a business associate, you're supposed to be doing those trainings anyway, right? Especially an annual training with your attestations and all that stuff. I know see a lot of the people on this call, you are business associates. You do work in the healthcare space. And by the survey at the beginning of this call, there was some that I'm not sure, but I saw a lot of those in the healthcare space. So it is important. And then leveraging that expertise to create those strategic partnerships to protect the healthcare organization. So that's what I got. Let me see if there were any questions. It looks like there was a question about how do we educate clients about the long-term cost benefits of proactive compliance versus the consequences of non-compliance? That's why I like to have those case studies, right? I show what the fines were. First-class breach notification letters have to go out to every single affected individual who they have to have credit monitoring. They have to have, you can show them again that case study that parallels their organization, and it's to me that's the most impactful thing. And I'll just, with a customer, if they're still on the fence about moving forward with some compliance products and services that we offer, I will continue to, here's another article, here's another breach, and each industry, whether it's pathology center or health plan or surgery center, spine center, pain management, mental health, reproductive rights, they all have their own areas. And that's when it comes to healthcare compliance. And, I'm sure CMMC has their own, special areas too, as it depends on what type of CUI and what type of contracts they're going after. But sending out, little tidbits, little bite-sized pieces that the customer can take in, and so slowly make that decision over time. I think that it does take a little bit of time, right? And it takes expertise, but that's why we're here to help. So if you have customers in that space that kind of need that, care and feeding to help them get on the bandwagon of the compliance side, happy to help with that. I think we're out of time. I see a couple more questions and I really appreciate that, but do reach out to your channel manager who invited you today. Really appreciate you for coming, and you can always reach out to myself and Dan. It looks like Dan has one more minute here to answer another question, and go ahead, Dan, it's yours.
Thanks, Sonya. So Chip, to answer your question, it is contract specific. So it won't be a requirement to register with SAM. As far as I can tell, it's specific to the contract. And then to Ryan, does that company have to be compliant with 800-171 if they're not handling CUI? I went back to read the DFARS 7012. In my interpretation, yes, they do have to be compliant with 800-171 because it clearly says the contractor shall implement NIST 800-171. But if you're not handling CUI, what you can do is talk to the contracting officer to find out specifically what controls that you're required to do. You may not have to do all 110. You may not need that CMMC certification, but there will be controls in NIST 800-171 that you will have to follow, and specifically ask the contracting officer what those requirements are, and with special attention to like risk assessments and flow down requirements, because those controls will most likely still be required.
Yeah, I've heard people go down the rabbit hole on that one. Essentially, like even if you're not handling CUI, you're still connected closely to a government organization, and that opens up the doors for all sorts of
The government,
concerns.
whoever gave you the contract, it's up to them to determine what's required and what's not. And you can ask for deviations from NIST, and you can also ask for exceptions. So it's not a hard line. There is flexibility. And then last, about the self-assessments on the off years from the every 3-year triennial assessment, it can't. So technically, it can be done by the same company. That's just not the best practice, because if the same company is helping you with your self-assessment and who's going and doing your third party triannual every 3-year assessment, they might be missing something. So our recommendation is to mix it up. In the off years, have a different company go help you with the self-assessment, and then pick a different company to do the full 3-year assessment. But I didn't find anything that said it could not be the same company. And don't hold me to that, but just based on my research here within the webinar, it looks like it can be, but probably shouldn't.
All right. Well, I think we have come to the end of our exciting compliance conversation. So thanks to those who hung in there. We only lost a couple people. I'm amazed how many stuck into the very end here. So thank you. We will be back next month on March 28th. So please do join us, and we'll have a whole new topic for you. If you have ideas, pop them in the chat right now, something you want to hear about. And we will definitely take that into consideration. And we'll see you next time. Thank you so much, Dan, for joining us. And thanks to our marketing team for helping us put this all together. And to each of our partners who joined today, we're excited to talk with you more about this. If there's anything we didn't get a chance to answer, happy to hop on with you. So thank you. We'll see you guys next time. Bye-bye.